Now let's take another close look at how to properly remove a helmet and some problems that you might encounter. Helmet removal requires 2 rescuers to perform safely. Take BSI precautions. Approach the patient from his front. This minimizes the likelihood that your patient will turn his head to view you, further compromising the neck and spine. Introduce yourself and quickly instruct the patient not to move. Position 1 EMTB at the top of the patient's head to maintain manual cervical stabilization. The palms should hold the helmet stable while the fingertips hold the lower jaw. Explain the need for removing the helmet and the steps involved in the process. Be sure to get the patient's consent before beginning the procedure. Evaluate pulses, motor function, and sensation, PMS, in all extremities. Do this by palpating radial and pedal pulses, assessing grip strength and flexion and extension of the feet, and perceived sensation while touching the patient's extremities. While the first rescuer continues manual cervical stabilization, open, remove, or cut the chin strap. Then place one hand on the occiput behind the patient's head and the other on the mandible. This hand placement allows you to assume manual spinal stabilization. The head must be securely held between the occipital region and the mandible. Support of the occiput will later prevent the head from falling to the ground when the space between the head and the ground is no longer held by the bulk of the helmet. The other rescuer can now release manual stabilization and slowly remove the helmet. Gently pull out the helmet's sides so that they clear the ears. The helmet should come off straight with no backward tilting. A full face helmet may need to be tilted just enough for the chin guard to clear the nose. Manual stabilization should be maintained throughout the entire process. It is important to support and prevent the head from moving as the helmet is removed. After setting aside the helmet, the EMTB reestablishes manual stabilization and maintains an open airway by using the jaw thrust maneuver. You are now free to apply a cervical collar and to begin the process of securing the patient to a spine board. Remember that manual cervical stabilization must be continued until the patient is fully secured to the board. Reassess the patient's PMS in all 4 extremities, noting any changes from your initial assessment.